Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Aim, triple board certified cosmetic surgeon and OBGYN. Let's get polished.
Expert on the Microphone series, we're going to be breaking the silence on menopause and perimenopause, a topic that affects half the population but still carries outdated stigmas. Did you guys know that 6,000 women in the US enter menopause every single day? That's over 2 million women every year, yet many feel left in the dark about what's really happening to their bodies. This segment is not just about statistics, it's about understanding, empowerment, and solutions. From skincare concerns and sexual wellness to debunking myths, we're assembled powerhouse of panel experts to guide you through this conversation. First up, we have Lana Kerr, the trailblazing CEO of CO2 Lift and Lumisk Skincare, whose revolutionary carboxytherapy treatments are transforming our skin even in the most intimate areas. Joining us is Dr. Daisy Aim. She's a triple board certified cosmetic surgeon and OBGYN whose practice in Houston blends beauty, health, and wellness. She also hosts and is the founder of the Polished Beauty Podcast. And finally, welcoming our returning guest, Dr. Doris Day, a world-renowned dermatologist, media personality, and author whose expertise on skin health and the mind-skin connection has earned her accolades across the globe. Let's dive in and get real about menopause, starting with the changes that we can see and feel. Welcome to the show, superstars.
Hi.
Thank you.
Hi, everyone.
So excited to have this panel, the mind-skin connection, Dr. Doris Day. I'm going to start with you. So as we know, stress is a major player in the menopausal journey, and it doesn't just affect our mood, it impacts our skin as well. And research has shown that stress hormones like cortisol worsen dryness, wrinkles, and even acne. So Dr. Day, your work on the mind-skin connection is groundbreaking. Can you explain how mental health ties into skin health during menopause and what strategies women can adopt to care for both?
This is such a great question, and it's so important because as a dermatologist, it's amazing how often our sessions seem like the patients like therapy sessions as much as injection and treatment sessions, but it is really all connected. And we now know that you have estrogen receptors in your brain and in your gut and in your joints and in your skin and pretty much all over your body. So the mind skin connection and the mind estrogen connection is very real. And when I address skin issues, I'm also addressing the anxiety and all of these stressors that can affect the skin and the hair. When you have the anxiety around menopause, you can have stress shedding of hair on top of female pattern hair loss, which can accelerate it. So I need to pay attention to what my patients are feeling, what they're going through in their lives, what their relationships are like, if I'm going to make a difference in their skin, especially around perimenopause, not just menopause. And I think the big mistake we make is that we wait until menopause to address those issues, when instead we have to look at this sort of grayish area around perimenopause. And the reason it's grayish is because it's very long, it's slow in how it develops, and it's different for different women. It happens at all different ages.
Yeah, bridging mental health and skincare is such an empowering concept. I mean, your advice to our listeners is invaluable. When does perimenopause typically start?
Perimenopause starts as soon as you start having an irregular period. So if your period has always been a 28-day or 30-day cycle, whatever your cycle is, once you start having it a little bit before or a little bit later, you've entered perimenopause.
These are signs, and they can start in your 30s too. Now, which brings me to my next question for Lana. During perimenopause, estrogen levels plummet, which reduces collagen production. And by age 50, we lose about 30% of our skin's collagen, leading to dryness, wrinkles, and a loss of elasticity. But your company, CO2 Lift, has revolutionized skincare with carboxytherapy, a treatment that boosts oxygenation and regeneration. So, Lana, please tell me how these treatments address the unique skin challenges faced by menopausal women.
Well, some of the things, as Dr. Day mentioned, drier skin, thinner skin. And one of the things that CO2 Lift carboxy gel does very well is increase hydration. It's like a tall glass of water for their skin. And I always talk about, the raisin grape analogy. We're born this beautiful plump grape, and then we turn into this raisin all over. And fortunately, we have, our two professionals here who help to slow that process down. The CO2 Lift is what tool that they use, or other physicians can use, or individuals use to reverse that, as well as elasticity. In fact, just one more point, we just completed a clinical with the Mayo Clinic, and they show that CO2 Lift produces type 1 and type 3 collagen, which is some things that's going to help women going into menopause, which is what is decreasing. So those are some of the things that we can do on the face. And then, of course, the skin on between our legs, that's another conversation. But again, we're addressing, dryness down there. We're addressing sensitivity down there. So those are things that's going to help women to navigate this period of life and still maintain the quality of life that they're used to.
So important. And thank you for your answer. That resonates with so many women experiencing these changes and looking for effective, non-invasive solutions. Now I'm going to pivot to sexual wellness post-menopause, Dr. Daisy. So menopause doesn't just affect our skin, it can also change our sexual health. Vaginal dryness, discomfort, and loss of libido are common complaints, but they're often ignored in mainstream conversations. And studies show that up to 50% of postmenopausal women experience sexual dysfunction, yet very few seek help. As someone who bridges cosmetic surgery and OBGYN expertise, how do you help women regain confidence and comfort in their intimate lives? And what treatments or approaches do you recommend?
Yeah, the first thing was, whenever a woman presents with a concern in the office, is basically just listen to her, right? Hear her story out, what has been happening in her life, where she is in her journey. And that really allows me to tailor a treatment for her. Because, as we age, as Lana has mentioned, Dr. Day mentioned, estrogen depletes and the vaginal tissue health changes. It becomes thinner, it's more sensitive in as far as discomfort, but the nerve endings are not as sensitive as well. So your pleasure is much decreased as you're older. So when I listen, I gather this information, then I start with a treatment option customized to her need. The number one priority is estrogen replacement, because there's nothing else that will replace estrogen in treatment of the sexual health of a woman. So there's local estrogen that I prescribe that they can use to improve it. But we do have adjuncts like CO2 Lift. We have medications that are non-hormonal that can be helpful. We have devices that you can actually use to boost, lubrication, helps with the tissue and sensitivity. And then, stem cells, is also helpful in that area. I package a treatment that is very comprehensive to her need based on what her concern is. Genital urinary symptoms of menopause is something that is known and is common. And a lot of women don't associate that with being menopause. They just think, oh, I'm running to the bathroom a lot lately, and not thinking it's because of their age or the menopause that's associated with it.
Such a critical topic, and thank you for those insights, because they're definitely helping destigmatize these conversations for many listeners. Now we're going to talk about anti-aging innovations with Dr. Doris. So many women in menopause are often bombarded with anti-aging products, but not all are effective or even safe. So as a dermatologist and innovator, what breakthroughs in skincare should women look for, and are there any specific ingredients you recommend for menopausal skin?
So I think it's addressed on several levels. One is internally with really paying attention to your diet. I absolutely think hormone replacement therapy is undervalued. And I think of it even as malpractice, that we're not telling more women about the value and safety and efficacy of hormone replacement in protecting collagen and protecting your brain, your heart, your joints, your bones, all of those things that hormone replacement does. I tell women that you're not taking extra estrogen. You're replacing what your body still needs but can no longer make. And you're supplementing what your body needs. And estrogen is not a carcinogen. People think about cancer as their main risk, when in reality, that discussion needs to happen. I'm not saying it's right for every woman, but I'm saying that we're not having the conversation openly and comfortably enough. And women think they just have to power through this phase. But in the office, we talk about the importance of diet, getting enough protein. Resistance training is really important. You build collagen in your skin from doing weightlifting, not just in your muscles. And that's important. I think collagen supplements can be helpful. I prefer usually switching off of a prescription retinoic acid to an over-the-counter retinol, because I think that they're gentler and they're even more effective. And they also are combined with other antioxidants that make them work better and are better tolerated. Then there's lots of peptides, stem cells, exosomes that we use. In-office treatment, SoftWave is one of my favorites because it has no downtime. The data behind it is great, and my patients are thrilled with the results, and it's very tolerable. So that tightens and lifts without injecting anything. Fillers and neuromodulators are amazing. We really understand the commonalities of how we age, the changes in bone and fat pads, and how to balance out. So the rate limiting factor in how you age are going to be your eyes. If the bones around your eyes shrink, that means the hole gets bigger and your eyes can either sink in or get more hooded. If you try to overfill the face to try to have the same structure you did when you were 20, your eyes are going to look smaller and more recessed. So you can't replace everything, but you can create balance and improve skin quality. And there's so much we can do with all the devices we have that can be safe and effective. But this is a journey. It's small things done over time that will make a very big difference.
Wow. Look at you. I mean, you said it all in like under 2 minutes. I know our listeners definitely appreciate your practical expert advice, especially on navigating the overwhelming skincare market, because you just nipped it all in the bud and gave me that 101 idiot's guide to skincare. So let's talk about busting menopause myths. Lana, let's tackle some of the myths head on. One of the most persistent is that menopause is the end of vitality and beauty, which couldn't be further from the truth. As someone at the forefront of empowering women through science-based skincare, how do you challenge these myths and help women redefine aging? I mean, you are gorgeous, you are beautiful, you are successful. Talk to me.
Oh, thank you so much for that. But yeah, and I'm menopausal. I finished my last period. My last was 2 years ago. But I think that every stage of our lives, they're beautiful things and they're challenging things. I mean, you think about, toddlers, they're challenged with, they can't walk, but we love toddlers. And then you go through the adolescent phase, they're challenges. Well, menopause, perimenopause is just another phase of life, but it's such a beautiful phase. I really like to think of this as the best time of my life. Truly, if I was to have a wish to go back in time, would I? Maybe to change some things in my life, but certainly I love this part of my life. It's really that, caterpillar to butterfly stage. We have the wisdom, we have the experience now. Fortunately, we have the technology that can help us to feel as if we are in our 20s or 30s, but we have the experience, we have the wisdom to navigate life in a totally different way with confidence. So I like to think of this time of life as an exciting time of life that we can be even more powerful and more successful. And then again, so it's about educating ourselves as to what it is we need to do. And I like something that Dr. Day said. It's not starting now at this age. Fortunately, I had women in my life that helped me from in my 30s to understand the importance of bioidenticals, to understand the importance of doing the steps needed so that when I'm here, I'm not going to feel the symptoms that many women feel if they have neglected to do things to prepare for this part of our lives.
We're going to talk about hormonal therapies and alternatives now. So HRTs is a perfect topic, is often a go-to solution for menopausal symptoms, but it's not for everyone. Meanwhile, non-hormonal alternatives are gaining traction. So Dr. Daisy, can you break down the benefits and risks of HRT versus non-hormonal treatments and how women can decide what's best for them?
Okay. Well, that's a loaded question. Do we have 10 minutes? I'm just kidding.
You have two.
So the benefits of HRT are endless. We've heard so much about it. And let me just backtrack. There are a lot of patients of mine that do not want HRT. So it's not for everyone. There are women that choose not to, and that's okay. So long as you're informed, educated, and empowered to make that choice, it's yours. But the benefits of HRT are endless. You're looking at hot flashes, night sweats. That's a common thing. But you also have vaginal health. As I mentioned earlier, it's a great benefit to be on HRT because your tissue is going to shrink, it's going to shrivel, it's going to whistle away, and it's good to restore it with estrogen. And then there's mood stabilization, just feeling better, cognitive improvement, sleep quality. That's one of the things that happen as you age. Your sleep quality just goes down. So HRT is beneficial on that. Some of the long-term benefits are your bone health. We talked about strength exercising. That is great, but HRT on itself improves that and helps decreases osteoporosis and risk fracture. Cardiovascular benefits, especially if you start HRT 10 years before your actual menopause, that is the most beneficial for you. If you do start it a little bit longer after your menopause, it may not be as beneficial for you. Then you have, as I mentioned, cognitive, and Dr. Day did a great job talking about skin health and hair health. So you have those long-term benefits. The risk of HRT, unfortunately, with the WHI study, there's all this misinformation out there about breast cancer and contraindication. And the short answer is no. But of course, the longer answer is each patient has to be individualized to see what the risks are. Another risk is endometrial cancer. If you're on HRT with estrogen alone and no progesterone and you still have your uterus, you are at risk for endometrial cancer. So you need to be on HRT that has progesterone to counter that risk. Then you have heart disease, as I mentioned. If you're starting a little bit later, like you're 60, I have patients that come in my office, 60 years plus, they've heard so much about HRT going on and they're like, I've never been on it. Can I get started? The short answer is, well, let's assess you and see what the benefits are, because it's all about the risk and benefits. Now, for the non-hormonal therapy, they tend to just treat a symptom. So you don't have this comprehensive beneficial effect of it. So there are medications that will just take care of your hot flashes, and that's it. Or medication that will take care of your sexual health, and that's it. And then you have devices that's very localized. So you don't have that systemic benefits when you are non-hormonal therapy. I have a lot of patients, as I mentioned, that do not want to be on HRT, and that's okay. So I don't want any woman listening to this feel like they're obligated or have to be on something. You do not. But so long as you're educated and informed, then you can make a choice.
Such a nuanced topic. Thank you for your guidance. It's definitely going to empower women to make informed decisions. Now let's chat lifestyle tips for menopausal skin health. So skincare isn't just about what you put on your skin, it's about what you put into your body. Dr. Day, can you share some lifestyle tips, diet, hydration, or habits that women can adopt to maintain healthy skin during menopause?
Yeah, this is a really important time to pay attention to what you put in your body. I always start with vitamin D because vitamin D is essential and we don't need to rely on the sun for vitamin D. I usually recommend vitamin D with vitamin K2 because that helps with vitamin D absorption and your gut biome changes so you don't make K in your gut as well as you used to. And then magnesium L-threonate, magnesium glycinate, both help with sleep and muscle building. So that's really important. And there are some other supplements that you can take as well, like DHEA can be helpful. Creatine is really important for muscle building, and that can also help the skin. So there's a lot you can do in terms of supplements to add to your diet, but making sure you get enough protein is really, really critical. And I think it's more important as you get older, whereas we used to undervalue it. Exercise becomes critical. Zone 2 cardio is the easiest cardio to do. It's just walking 20 minutes. You're not stressing your body. You can have a conversation when you're in zone 2 cardio. I walk to and from work every day. That's my zone 2. It's 2.5 miles each way. So I get my zone 2 in. But then doing resistance training, also jumping, things that are going to stimulate bones and your circulation are really, really helpful. One of the things, even though this is an internal, is when you hit peri and post menopause, you're really not building collagen. So when you're doing all these activities outdoor, being extra vigilant about your sun protection to protect your collagen is important. And then speaking of collagen, I think collagen supplements are helpful. They're a little bit controversial where some doctors don't think that there's as much evidence-based medicine, and that's true. We always want more evidence-based medicine, but these are supplements. You're never going to have pure science behind it. But the hypothetical data, everything that I've seen that shows how when you take collagen, this is a protein, even though it gets metabolized, it does become building blocks for collagen and can help joints and skin and hair on the other side. And then the carboxy mask, as Lana has, my patients in peri and post menopause love this masks. I have brides do it the day before their wedding. I have the mother of the brides in peri and post menopause do it with them. And they email me from wherever they are telling me how their skin was radiant and glowing. And even with the vaginal carboxy, they will tell me that they have less urinary incontinence and they have better sexual pleasure. So these are things you can do at home. They're not costly. You can buy it on Amazon or get it from your doctor, and they make a huge difference in how you feel and how you look and how you age.
Wow. Again, great answer, great guide. Thank you so much. Simple, actionable tips like these that definitely make such a big difference in how women feel in their own skin. Thank you for that, Dr. Day. Lana, I'm going to segue into Dr. Day handed it off, intimate skincare solutions. So here's something we don't talk about enough, skincare for intimate areas. Menopause can cause significant changes, and self-care in these areas is often overlooked. How does your work with the CO2 Lift vaginal vulva rejuvenation treatment address these unique needs? And what kind of feedback do you hear from women who've tried your treatments? I know we just got a very organic endorsement from Dr. Days and her patients.
Yes, that was good, and thank you. Thank you for saying that to Dr. Day and Dr. Daisy as well. The one of the things is, in terms of pleasure, I think that that is so important for women. The benefit of sexual pleasure to just stress, to our overall well-being. And what happens is that our clitoris, it, just like everything, blood flow slows down. Our clitoris, to function optimally, needs blood flow. And CO2 Lift is doing that for CO2 Lift V is doing that for a woman. It's helping a woman to, it's almost reversing clitoral atrophy. Because, I always say a man wouldn't have sex with a flaccid penis. So many women are having sex with flaccid clitorises. And so that's why they're not getting the pleasure. That's why they don't want to do it. If you're not feeling anything, why would you? So the CO2 Lift V is very effective at that. Also to sustained lubrication. That's not just in the beginning. Sustained lubrication is important. And that's what a woman is getting with regular use of CO2 Lift V, as well as the thickening of the tissue. So Dr. Day mentioned even some women are having improvement with stress incontinence because of the healthier tissue. They're feeling that. So I think it's important from a physiological point of view, but also from an emotional and mental point of view. Women are such cerebral individuals. Our biggest sex organ is our brain. Just the fact that we're taking care of that area of our body, it's going to make us anticipate that it's going to be pleasurable. It's going to be fun. But again, we're talking about sex in this aspect, but it's just even just healthy vaginal health. It's about feeling empowered in that area of our life. It's feeling in control in that area of life when so many of the other areas of our life may be out of control in this part of our life. Having that control is going to help us to feel more confident and navigate this area of our life, or this period of our life, with more ease and more peace and more patience.
Definitely, your answer shining a nice light, a bright light on an often neglected area of self-care, our intimate skin down there. So thank you. Now, Dr. Daisy, perimenopause and menopause bring a unique set of challenges that extend beyond just physical symptoms. Women often find themselves navigating shifts in their overall health, emotional well-being, and even self-image simultaneously. So self-image, I want to stress this. The intersection of health, wellness, and beauty plays a critical role in helping women not only cope, but thrive during this stage of life. So your expertise beautifully bridges these three pillars. How do you see them intersecting to support women during perimenopause and menopause? And what holistic approaches do you recommend?
Yeah, well, that's a really beautiful thing. I think the first thing is that the commonality is nutrition, right? Prevention is always the best way. So before you start addressing health, wellness, and beauty, we have to talk about what is on our plate. What are we eating? And that's the biggest holistic approach I have in my practice, because if you can control the intake, everything else follows in line. So, the standard American diet is not the most nutritious diet. And anyone that disagree with that, I'm not sure what you're eating. But, really being intentional about how you do your grocery shopping. And this is things that I tell my patients. When you go into the supermarket, go to the produce section. That should be where most of your purchases is. Avoid bioengineered food, avoid ultra processed food, avoid, eating out, or if you eat out, be sensible about what you eat, because all of those things will tie into this intersectionality between health, wellness, and beauty. So once you prevent, or at least be intentional about what you eat, then as far as your perimenopause, menopause years, it's easier, because what you do in your 20s and 30s will catch up with you in your 40s, 50s, and 60s. So by default, when you're young, you can get away with so much because you have the benefit of being young. However, in your 40s and 50s, those poor habits or poor choices that you did not make will catch up with you. So around this time, it's really big for women to understand that, first, give yourself some grace. You probably didn't understand what was going to happen at this time. And now that you're here, you approach in a very sensible way. First talking to your doctors and getting ideas. And you also do your research. The one thing about social media that I think is fantastic is that there's so much information out there. Of course, there's some misinformation and misguided stuff, but for the most part, you can actually ask questions and get so much answers and feedback. So when you have that, and me as a professional, the conversation is more fluid. So I really appreciate when a patient has done some research and comes to my office and can actually talk on a level where I feel like, okay, they're really taking ownership of this journey.
Wow. Well, we are officially out of time. This was a very, very enlightening panel. I think we covered everything from skincare to vaginal health to hormones and to overall just mood. I thank all of you for coming on. It was so enlightening and transparent. You guys are amazing.
Thank you.
I hope you enjoyed this episode and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, a new episode drop every Wednesday, so stay tuned. Please like, share, follow.